Hello everyone. Hi, this is Saurabh Kochhar. I am founder and CEO of Meddo. Meddo is a connected patient care platform that we're building out of Delhi. And I have with me, and I have the pleasure of having with me, Mr. Vijender, who's CEO of Metropolis, and has like I think more than a decade years of experience in running healthcare chains in diagnostics, starting with Dr. Lals and now Metropolis. Sir, absolute pleasure to have you. Welcome.
So thank you so much, Saurabh. It's again a pleasure here as well in talking to you on this platform.
Wonderful. Sir, I think 10 plus years, there's very few people who have had that kind of, I would say, experience, being at helm of such large organizations. Walk us through a journey. Tell us how it's been.
Yeah, I think it's been almost now 15 years journey into diagnostics. And in fact, I had my first-hand experience onto this healthcare was when I had joined Ranbaxy. And that was the company which wanted to actually bring out some of their products and create a platform called as OTC, over the counter. And that was the time when I got to know a little bit about healthcare. So my first-hand experience with Ranbaxy has really helped me a lot in terms of understanding the nuances of this healthcare business. And then after that, I joined my first, diagnostics company, and that was the time when diagnostics was transforming, kind of into a proper business and into a proper business models. And that's what the time when one of the private equity funding actually funded into that company, Dr. Lal Path Labs, in 2006, 2005 actually. And that was the journey when I started with that company. And then later on, after 10 years, I joined Metropolis. And this is how I'm here today after, almost about 15 years. And I'm still at Metropolis.
Yeah. No, wonderful. But I don't think anything could have prepared you for what we have seen over the last year, this entire 2020. So how have you been dealing with it?
So COVID again is some. See, remember that we are into a business where we are dealing with different diseases, and most of the treatments are based on diagnostics. Until and unless the doctor gets a diagnostics report, he's not able to give a proper treatment. So definitely we've been dealing with the patients and different diseases. So it's not something new for us, but yes, in the past also we have seen many sort of epidemics, like there was dengue, then there was swine flu. So we've been pretty much dealing with these diseases. Only it's important that you need to be ready with a proper sort of infrastructure, be it people, be it basic infrastructure in place. So I think we've been very much on the helm of affairs. But this time the challenge has been a little bit more sort of difficult, where COVID has actually changed the entire thought process in terms of doing your business, in terms of consumer behavior, the behavior of staff, employees, doctors, customers. So everything has got changed. Because it's the first time that we faced such kind of pandemic, where there are no sort of treatments available, no vaccines. So this was a bit challenge, and completely put us into a different sort of ball game. But yes, I think we've been able to manage it well. And if I remember Q1 when it actually started, there was a bit of panic among all of us, not just patients, but also among all of us. And probably the panic to some extent has settled down to some extent, which gives us some at least sigh of happiness or some kind of satisfaction that we've been able to serve the nation when the nation required us.
Wonderful. Walk us through some of those challenges and what all you had to do to kind of manage them.
Yeah,
I understand, especially with the frontline staff and with this kind of panic that you talked about, I can imagine it wouldn't have been easy.
Yeah, in fact, in the month of February was the time when in India actually we really got serious about COVID, because it all started somewhere in October, November, starting from China and then later on to other countries also. But we were not very sort of serious about it. We thought that it will go on its own, and it's not going to be our problem from Indian point of view. But February was the month when we really got serious, and in the month of March itself, actually, we had a meeting with all the stakeholders in our company, all the leadership team, and we had three basic challenges which we had to address. First was to have a business continuity plan. Number two was to set up COVID testing facilities, and third, of course, was a little bit on safety of our employees and patients, because that was critical. And I think at that point of time, as I mentioned, there was a bit of panic in not in the consumers, but also in the employees also. So we had to quickly come up with a welfare program for our employees. Actually, that was a game changer, because what we quickly did, we formed a committee, and under that committee we had some put in some money to take care of our employees in case of any emergency, even for the family members also. So that was a big game changer in terms of changing the mindset of our employees. And from there we all started our journey. And as I said, that the three basic projects which were at hand were successfully executed, and we were the first one who actually were ready with COVID testing facility in Bombay. So we had set up two facilities in Bombay alone, and then later on we expanded to four more facilities across the country, and then today we have about 15 COVID testing labs across the country.
Wonderful. That's wonderful. And how do you think this entire testing, because I think what we've seen is, a lot of ups and downs when it comes to where the testing is happening, how the testing is happening, at what price the testing is happening, and all of that being very closely monitored, regulated. How do you think, what's been your experience with all of that?
Yeah, when actually government when the ICMR actually allowed the private players, because they had their own sort of protocols whom to give approval. So there was an NABL sort of approval which was required, and you had to have basic technology in place in order to give testing. And RT-PCR was the technology which was sort of approved by ICMR authorities, and then top of it we were accredited by NABL also. So basis that we got approval from ICMR. But the challenge again was the regulatory stuff, because government itself had its own challenges, and definitely they also wanted private players to follow certain protocols, because it shouldn't have created more havoc in the consumer's mind. As I said,
Right.
there was a bit of panic, which actually was a big concern for the government authorities and also for us. So there were a lot of regulatory stuff. But quickly, actually, we worked with authorities, ICMR. We used to have various platforms where we were part of the discussions, and hence we could sort of create a platform. Like government has created a platform called RT-PCR app, where all the patients were supposed to actually register themselves on this RT-PCR, and there were about 60 questions which our phlebotomist or the patient were supposed to fill in those questionnaires, and then only then the sample can go to testing, and then later on we had to actually inform the municipal corporations about the results, because every patient was in case if a patient was positive, the municipal corporation had to go and quarantine the patient, and also look at the social impact of that particular positive patient. So these were a bit of challenges, difficulties, and initial phase there were also challenges in terms of getting kits, because there were only two suppliers initial period in the month of late March. So this was also a bit challenging for us. But later on, many more suppliers came in, and many more new technologies also came into play, which actually gave us some sort of sigh of relief in terms of providing timely reports to our patients. And there were a couple of other challenges, that the country was under lockdown. There were no transportation. There was no sort of ways and means to transport your samples from A city to B city. So this was a bit of a challenge. But internally, our people actually really worked hard. In fact, our own people used their own transportations to actually ship the samples, because we wanted to stay in touch with our consumers, our customers at a time when they needed us the most.
Great. And about the specific issue around pricing, what are your thoughts around that?
Yeah, initially, definitely price capping is the first thing. Whenever there is an epidemic or pandemic, the government actually not only regulates the platform or the technology piece to give out results, but also pricing also, because the government's agenda is, of course, to make it accessible and affordable as well. So this was a bit of challenge initially. The price decided by ICMR was 4,500. But in the month of June, actually, the government actually wanted to cut down the prices further, and that was the time when we started facing challenges from the price point also. But thankfully, as I mentioned, that initially there were the challenges from suppliers' point of view also. But later on, there were many more suppliers, and by that time, we had built significant volumes, and at the back end also we did a lot more automation in order to match the prices what the government wanted. So this is a part and parcel of this whole pandemic, and every month there has been sort of price challenge, and then every month since it has now become a state affair. This COVID, though healthcare largely in India is a state affair, but COVID now in the month of June became a state affair, and hence state government started negotiating with us. But fine, I mean everything is fine in terms of whatever the government decides, and we've really worked our ways and means to actually service our patients and our citizens.
Yeah, I actually fully agree. I think the way the private practices, the private labs were very quickly brought in, to kind of manage the entire situation. I think that's very commendable. I agree with you that, with pricing going up and down, it does become a challenge, but I think the entire sector has responded beautifully, in terms of coming together and making each of those solutions work. And I think while I would never hope that we ever see a time like this again, but I think one thing that has happened beautifully is how everybody has come together to fight one common agenda. And I think I hope we don't get to see this again in our lifetimes. Yeah.
Yeah, at least now we are already prepared. This kind of pandemic, and I think for any kind of future such similar situation comes, then I think we are all together and we've learned our ways how to deal with such kind of pandemic. In the past also we have definitely have done these things, and we have faced such things as I mentioned for dengue or swine flu. But in this case it was a little different, and still we are all struggling to find out some treatment, though there have been news about vaccinations which are going to come to India very soon, maybe January, and so probably from there things will improve.
Yeah, hopefully. And actually that takes me to, the next thing, moving forward. How do you see things changing? How do you think what we call this new normal, right? How are we going to adjust to it? How much of it will stay? What are your thoughts around that?
I think the behavior definitely has changed because this is something which has brought in a lot more sort of changes in our behavior, the way we used to do business, the way we used to go for shopping. So everything has changed, and certainly safety is the topmost priority, because in COVID there are only two things as of now which as a patient or as a consumer we have to follow. First is to take care of safety, whether it is by using masks, maintaining social distancing, and then second is having testing. So these two things are primarily very, very important. But definitely safety is something which is top of mind in everyone's mind, because the consumers doesn't want to actually go down to streets or go to hospitals or other places because they all are concerned about carrying infection. So this is something which has really in coming days definitely going to change. And in past months also we have seen this home delivery systems have really taken up a big shape in terms of demand, because these are the most safest services, because everything if available at home, then that would be best preferred choice for the consumers. Though in India these delivery systems have been there, especially on the essential items, but not too much on the healthcare side, except for we used to have home visit services where our phlebotomist used to visit patient's house to collect samples and bring it to our labs, and then reports were usually given on digital platforms. So this is not something new. But nowadays, more than home collection, people want more sort of services where everything comes to their house. And in my view, I think going forward, even little bit of inpatient, what we call is IPD, very basic IPD kind of setups could also be set up in homes for critical patients, because the patient doesn't have to actually go to hospital for their IPDs, but a little bit very basic level of IPDs can also be set up in the houses. And there are many companies who have already started some work on rehabilitation, because once the patient get discharged, then probably these rehabilitation companies, they take over, and then they look after the patient, whether it is physiotherapy, whether it is nursing, whether it is any kind of services which usually used to get in the hospital. So these are some of the changes which definitely are going to be part and parcel of healthcare system also. And as I said, at Metropolis also, we've also spruced up our home visit services. In fact, there has been a lot more sort of automation even on home visit services, in order to provide convenience and also good experience. So this is what is going to be a new normal as far as diagnostics business are concerned, as far as healthcare systems are concerned. But definitely things are going to change. And in fact, in our company also, we're also started tracking both brick and mortar in facilities, as well as home visit facilities. Though in last month or so, I have seen little bit traction on our footfalls to our centers also. However, that will continue to be there, but home visit seems to be taking a better shape, and would certainly be growing in a much faster way as compared to the previous years. And that's what at Metropolis we plan to actually put up this home visit services in at least 65 cities, top cities of the country. So what I call is that we are trying to sort of track click versus brick. Click is something where patients have started at a click of a button you order, and instead of
Yeah.
going to a brick and mortar outlet. So we have started tracking click versus brick, and in order to keep our eyes on both the business, and accordingly we'll take steps.
Wonderful. Also taking cue from what you were talking about, one of the other good side effects of the last year has been this entire push to digital health, push to home health, a lot of what you talked about as well. And marrying that with the entire governmental push, both on whether it was the telemedicine guidelines or now with the National Digital Health Mission. you know how are you seeing these steps, especially around the National Health Authority and the National Digital Health Mission, pushing to electronic health records and stuff like that? What are your thoughts around that, and how is Metropolis gearing up to kind of ensure
I
everything is
think,
in line?
yeah, I think it's a great initiative which the government has initiated under the guidance of Prime Minister of India. I think what they are saying is that they want to actually improve the healthcare systems in India by getting some digital intervention into it. So this definitely is going to help the country in many ways, and their motive is to make healthcare a universal kind of access, where the patient doesn't have to sort of travel down to multiple levels of services, because in India there is not one single platform where the patient actually can go to that platform and avail different services. So this is something a great initiative taken up by government. And end of the day, digitization is something which definitely is going to play a big role in coming future when we talk about new normal. So NDHM is basically a digital platform, building digital platform where all the medical records will be stored, and there will be one identification, one unique identification number for individuals, so that the patient and the service provider can track the overall performance or overall sort of state of that patient. So this is something which is a great initiative. See, healthcare again works on SOPs. if you see, healthcare is basically completely dependent on SOPs. What a diagnostics company or any healthcare company, they have a written down SOP in order to sort of follow certain protocols. Because in this whole chain, if one person makes a mistake, if one step has some kind of gap, then the ultimate result will be bad. So actually, automation is something where all your SOPs are actually put into digital and it's automated, so that it becomes less of manual intervention, so that there are less errors in the whole system. This whole business is all about making no mistakes. But healthcare being very high on manual interventions, that is why there are chances of more mistakes. With this digital platforms, I think there will be less chances of making mistakes, and the overall efficiency and the convenience what the patient wants would also further improve through these digital interventions. And end of the day, uh, as a country, we need to have such a platform where a patient can walk into any sort of center with all his record on one platform, because it becomes easy for the service provider and also for the patient also to actually to move fast in the whole chain of treatment.
Understood. No, I
But
think
there are
that's
definitely there are definitely challenges also into it, because there has to be certain regulatory stuff also. Especially we have been very concerned about safety of data, privacy of data. So all these factors are something which we all together along with the government have to work together in order to actually give full confidence to the patient that your data will never be misused, or your data will be private to you. So there are few challenges which both the private players and along with the government authorities have to work together in order to make it more effective, so that the patient actually gets the benefits of all these initiatives.
no, wonderful. I think I fully agree. It's a fantastic step in the right direction. But yes, while we go down this path, the privacy and the security of the data is going to be one of the biggest challenges, and especially with from a regulatory perspective and from technological perspective. I think you're absolutely spot on with that. At least I
Yeah,
fully.
yeah, correct. So I think important here is that data is what? Data is basically consumers.
Yeah.
And in today's world, what many of the companies are talking about big data. Big data is what? As consumers, we are being used as products. So data is basically we are being used as products, and how do we use this product in
Hmm.
order to sort of upsell, cross sell. But in healthcare, the intent should not be to be used as products. The
Right.
intent ultimately is to provide better treatment, provide
Correct.
access, and hasten this whole treatment process so that the patient actually recovers faster.
Yeah, yeah. No, I think India is supremely lagging when it comes to evidence-based practice, when it comes to,
Yeah.
using data to furthering treatment. You're right. I think that's the direction we need to take, and hopefully, at least I know the intent is that, and let's say I'm hopeful that we stay the path and don't stray down and using this data for things like advertisements and stuff. Thank you so much, sir. Thank you so much for your time. It was absolute pleasure again to be speaking with you. But before I let you go, any quick thoughts about the VOH broadcast and VOH in general?
No, I think it's a great platform, and this is something will sort of bring in lot more sort of experience, and getting on this platform, experienced people from healthcare or any other domain will definitely help the companies or even the startups to actually learn from our experience, and take it further, because definitely in India needs lot more entrepreneurs, lot more sort of new startups in order to add or contribute to the nation's growth, especially in the healthcare domain.
Wonderful. Thank you so much. Thank you for your time.
Thank you so much. Thanks, Saurabh. Thank you a lot. Thanks. Bye bye.